COVID-19 actually spreads by contact and droplet. We know that, and we also know that it does not transmit via the airborne route or through the air like measles would. It's not a virus that floats in the air for hours and hours. It's really a virus that transmits in the droplets from our respiratory system when we cough and sneeze and expel. They are in the air for just a few seconds and they slowly drop to surfaces, the floor, or end up on other persons. So that's very important. So that's why we recommend contact and droplet precautions, and we're not recommending airborne precautions. What does that mean? So for example, when somebody shows up in one of our facilities, if the person has respiratory symptoms, we ask them to put on a mask, a procedural mask, a regular mask, not an N95 mask. Why is that? That's because if the person is going to cough or sneeze, it'll contain the droplets and prevent those from going on surfaces, on other persons, or on objects that could potentially eventually infect other people. When do we need to use more precautions than just a regular mask? The regular mask is working well in the situation I've just described. It's also good for healthcare workers performing a clinical assessment, examining the patient, and even when taking a specimen from in the nose or in the throat, as I mentioned before. And that a regular mask, procedural mask is sufficient, but in that case, to make sure, because if you take a specimen in the person's nose and mouth, they might cough and sneeze. You also need a face shield or goggles to prevent your eyes to also be exposed to the virus. So that is why we recommend that. When do we recommend the use of an N95 mask? In the day-to-day work that we do, N95 masks are useful for airborne precaution, and that includes measles, tuberculosis, and also on rare occasions when, for example, in this case, a COVID-19 case is going to go through intubation, and any of those procedures that we call aerosol-generating procedures, and there's a list of that. In those instances, then we recommend airborne precautions, which involves an N95 mask, and also, well, of course, the goggles or the face shield, because it's still droplet precaution, and also when we talk about negative pressure rooms and things like that, or at least a private room. So this is when we increase the level of protection, but in very, very particular situations. Ordinarily, this virus spreads, again, by droplets and by direct contact with secretions.